Kia ora team, my name's Ben and you've finished your primary survey, so now we're looking at our secondary survey. So first up, let's get some more information, more details about your client. So we want to do our subjective interview. So you can use the sample mnemonic here. S is for signs and symptoms, what seems to be wrong, and then A, allergies, do you have any? M, medications, are you on any medications? Have you taken any today? Have there been any changes to your medications? And then our P is our pertinent or past medical history. Are you diabetic? Have you had a stroke? Do you have a history of heart problems? And then last ins and outs, what's their eating and drinking been like? And their toilet, so both urine and feces. And has that changed? And then E, events leading up. What happened and then what was happening before that? It won't necessarily happen in this order, and it shouldn't necessarily happen in this order you're questioning, but it's good to go back to it to make sure, have I covered all those bases? Sample. Gorgeous. Next, we can do a central nervous system assessment, testing their memory. Can you remember these three words? Whatever three words you're going to remember, ask them to remember. So fluffy pink unicorn, get them to repeat it and say, I'm going to ask you again in a couple of minutes. And then for our motor assessment, we want to look at their face and limbs. So get them to smile, puff out their cheeks, poke their tongue, and then with their limbs, can you wiggle your toes? Can you squeeze my fingers? Then go into our pupils. When you look in them, are they equal? Can you get them to track your finger? And then are they reactive to light? Getting the pupil torque out, coming from the side, looking to see if the pupil reacts, and then taking it off, come again, and then see if the other pupil also reacts. And do that on both sides. Coordination, can you touch my finger and touch your nose? And then move it around so they have to, it looks like I'm failing. So we can assess their coordination. And then sensation. As soon as you're going to touch someone, we have to make sure we get consent. So I just want to check your sensation. Do you mind if I touch your face, arms and legs? No? Great. So can you feel this? Can you feel this? Can you feel this? Can you feel this? And then make sure going down each of the limbs as well. And then memory, go back to, what were those three words I told you? Fluffy pink unicorn. Great. And then finally, if it's appropriate, assess their gait. So if they can walk a few paces, turn around and walk back. If this is a lovely little old lady who's fractured their hip, well, this isn't going to be appropriate as a central nervous system assessment, so depending on the injury. All right, so we've gone through our questioning, we've done a central nervous system assessment, and we can get a better assessment of their mental state by looking at the Glasgow Scale. So remember, it's scored 4, 5, 6, so eyes, verbal, and motor. For the eyes, are the eyes spontaneously open, or are they open to a verbal response, or are they open to a pain response, or no eye opening? So 4, 3, 2, 1. Then for verbal, are they orientated to the day, time, and place to get a 5? So you could be talking to someone and they could appear coherent and articulate, but they could think they're in Buckingham Palace and they're visiting the Queen. So therefore, they wouldn't be a 5, they'd be a 4, confused. And then 3, it can either be very confused or inappropriate words. Where are we at the moment? Apple pie. And then 2 is incomprehensive, so moans and groans. And then 1 would be no verbal response. And then finally for motor response, can they follow commands? So if you've just done your central nervous system, you've already asked them, can you squeeze my finger or can you move your toes? So if they can do that, that's a 6. And then 5, if they can't follow command, we're going to do a pain response. And then do they localize the pain? Do they reach to the sore spot or look down to the sore spot? If they don't do that, a 4 would be withdrawals from pain, so pulling away from a painful stimulus. And then 3 is abnormal flexion to pain. So when the whole body does a flexion response, and 2 would be extension. And then 1 is no response. So you can only get 3 or a maximum of 15. Alright, then before we proceed on, we want to get informed consent. So I want to do a more thorough assessment because we don't want to miss anything. So this is going to involve me exposing your chest, arms and legs to palpate for injuries. Is that okay? Depending on your client is how thorough this assessment is going to be. If they're GCS 15 with a very low mechanism of injury, we may not have to do all of this. But if someone's consciousness is lowered or the mechanism of injury is higher, we may have to go through a full secondary assessment. Okay, informed consent. Then let's work our way from the top to the bottom, so head. With all these bits, we want to think expose, look, listen, feel. So at the head and face, we're always going to be looking for bruising, lacerations, and deformity. And with the head and face, so the nose and the ears, do we see blood or cerebrospinal fluid coming out? Around the mouth, are there secretions? Is there pulmonary edema? Any vomit? Any blood? If they're conscious, you can ask them, can you run your tongue around your teeth to check if there are any missing? Okay, going down to the neck. So with every new body part, think expose, look, listen, feel. So neck, looking for bruising, lacerations, any deformity. Do they have a medic alert necklace? That could give you a lot of clues about their past medical history. Then look at the tracheal alignment. If they're in respiratory distress, you may get a tracheal tug with inspiration where the trachea pulls down, or an aortic aneurysm may give you tracheal deviation during systole. So as the heart contracts and we get systole, we may get pulsing of the trachea. And then jugular vein distension. So the jugular veins bulging out and thickened. So all these can provide clues as to what's going on, what the pathology could be. Then going down to the chest, you may have to expose the chest. So again, checking for consent. I just have to expose your chest to check for injuries. Is that okay? Yes, great. Then we're going to look for any bruising, laceration, deformity, any penetrating injuries, any scars, and then observing, is their chest rise and fall? Is it symmetrical? Is it a good rate and depth? How's their work of breathing? Is there accessory muscle use? Are they in the tripod position to try to help them breathe? Then we want to auscultate. So expose, look, listen, feel. We're going to listen, auscultate, and we're using a step ladder approach so that we can compare one side to the other and making sure we've got the upper, middle, and lower lobes, and trying to listen for any wheezes, any crackling, or are there absent breath sounds. Then we want to palpate. So making sure we're palpating our collarbones, sternum, ribs, and then we can palpate on the rib cage and get them to do a big breath in and out, and we can check the chest rise and fall to see if it is symmetrical. Okay, coming below the chest, we hit the abdomen. So again, expose, look, listen, feel. And when we expose the abdomen, are there bruising, laceration, deformity, any distension, any scars? And then when we palpate, we want to palpate gently to start with, and starting away from the painful size and using a wave motion, just checking for any tenderness or any masses. And once we've done it once gently, then potentially we can go a little bit deeper to check for any pain or any masses. Then the pelvis, expose, look, listen, feel. When we expose the pelvis, we have to just come down so we can see those bony landmarks, and we want to observe for any bruising, laceration, or deformity. And we want to palpate those bony landmarks. So the ischial tuberosity, the anterior superior iliac spine, the pubic symphysis. But we don't want to rock or lean hard on the pelvis because we've got some big blood vessels, and if there is a fracture to the pelvis and we rock and cause those blood vessels compromise to them, then we can bleed a significant amount into our pelvis and die. So we want to look after that. Don't rock, we just want to palpate. Then once we've done the pelvis, we've got our four limbs. So expose, look, listen, feel. We're looking for bruising, laceration, deformity, and we're comparing our left versus our right. People, again, might have a medical alert bracelet, so that would be good to look for. And when we're comparing left to right, like what's normal for them, does it look different? Then we want to palpate the bones, so we have to be pretty firm, palpating deep to palpate the bones, looking for any abnormality. And then we want to look at the limb baselines. So our limb baselines, we have neurological ones, so can they move that limb? Can you wiggle your fingers, bend your elbow? Can you wiggle your toes, move your foot and knee? And then sensation, can you feel this? So light touch, can you feel this? Can you feel this? And comparing both sides. Then our cardiovascular baselines, we're looking at capillary refill time, the skin color, the skin temperature, and pulse. And again, comparing left arm to right arm and left leg to right leg. And that brings us to the back. So when assessing the back, depending on your suspicion of a spinal injury, we may have to log roll and we have to protect the neck. So you may need your offsider or some bystanders to help you roll that person safely. And we want to expose, look, listen, and feel. So looking at the back for any bruising, laceration, deformity, swelling, and then we can listen. So auscultate. So auscultating posteriorly, looking at upper, middle, and lower portions of the lungs. And then we want to palpate along each of the vertebrae and along each of the ribs, looking for any pain or any abnormalities. And that is your secondary survey done. Good work, team. Happy studying.